we have today Stephanie with us to do the peripheral vasculature, the lower extremity. Obviously in office we would have a proper table and proper setting. We have a makeshift setting right now for the setting that we're in. So what we're going to do here is first I'm going to indicate to her that I'm going to be inspecting down from her toes all the way up to like her groin area. She might not know it as the inguinal ligament, so I'm going to refer to it as the groin area. And I'm going to have to roll her articles of clothing back so so I have access to viewing that. And please ignore if a cat does come through the video. I'll shoo him away. So I'm going to just roll this up just right to your inguinal ligament. I'm going to tuck the gown in. Okay. So now that that's done, I have access to viewing from the inguinal ligament all the way down to the toes. I'm looking for skin discoloration or any skin irregularities. We're looking at the hair pattern as well, looking at if there's like any lesions, freckles, moles, tattoos, which we will note. We're also looking at the ankles if there's any swelling, any lymphitis, any edema or brown edema or any type of swelling. We're also looking at the toenails, looking to make sure that there's no swelling, there's no fraying of the toenails, there's no pitting. We're also looking at the feet as well for ulcers or anything that is asymmetric or off. We're looking for scarring as well. Everything looks good upon inspection. Next we're going to do is temperature. So I'm going to take the back of my hands, just run them just hovering over your legs to feel for temperature, all the way down to the toes. That feels good. Next we're going to look at her vasculature, and we're going to look at the blood flow to the toes. Again, same thing we did in the upper extremity, just slightly compressing and watching it to come back for a pink, healthy color. Good. And that looks healthy. Next, what we're going to do here is I'm going to palpate the arteries, and we're going to feel the arteries. So first we're going to start with the dorsal pedis. Good, that's even and symmetrical. Next we're going to do is the posterior tibialis. That feels good as well. Next we're going to go up to the popliteus. So I'm going to have her bend her leg up, keeping her foot flat on the ground. I'm going to take two hands, my thumbs in line with her tibia, wrap around the popliteal fossa. I'm going to move the muscle around, and I'm going to just provide a little bit of pressure anterior and superior to get a good palpation. Good. That feels good. I'm going to don't mind me, I'm going to hop over. I'm going to have you bring that leg down, bring this leg back up, and I'm going to be feeling the same thing over here. Good, that feels normal as well. So I'm going to come around. Next, we're going to be feeling for the femoral artery as well. So I'm just going to be, in your crease line, your groin line. It's called the inguinal ligament. There is a nerve artery in vein and lymphatic that runs over that. So I'm going to be palpating for the artery, feeling for that, okay? Good, that feels normal. I'm going to go to the other side and compare it to the other side. And that feels normal as well. Next, we're going to do is look for edema. So we're going to go to 3 spots. We're going to do the dorsum of the foot, the medial malleolus, and the shins of the tibia. Good. There's no edema here. If there were, it would be a scale of 1 to 4, or you also can scale it on the amount of time that it takes for the edema to be resolved. Next, we are going to palpate the ankles. We're going to be just looking for any buildup or any like brown edema that would just be kind of rough and just not normal, and would be like a rough texture, which that is normal. Next, we're going to go up to the femoral artery. I'm going to be palpating the lymph nodes of the femoral artery, the vertical and horizontal portion of the lymph nodes, of the femoral lymph nodes. Good, that feels good. And again, this is a circular motion that I'm feeling. Good, and that feels normal as well. Next, we're going to listen for bruits, so we're going to listen over the femoral artery. So I'm just going to place this again over that artery that we're listening to, we were palpating, and we're just going to be listening to that this time, okay? And that sounds normal. And again, that's with the bell, in case you weren't able to see that from here. Next, what we're going to be doing is we're going to be checking for a hernia. So I'm going to use the navel lineup. So with the pinky finger being the, the pinky finger being all the way where I want to have my palpation to check for the hernia, the correct location of the hernia, if there is a hernia. So I'm going to palpate there. I'm going to ask my patient to turn their head away from me, and I'm going to ask the patient to cough. Good, that was normal. If that was indication of a hernia, you'd feel a protrusion over the fingers as she coughed. I'm going to also assess the other side. And cough. Good. And that's normal as well. So now that we've assessed that, we are going to go to Hammonds. So I'm going to lift her leg up to 45 degrees. I'm going to dorsiflex the ankle, and I'm going to provide a little bit of pressure to the back of the calf. Good. And no symptoms there. Just jump over. I'm going to head to the other side and do that as well. 45 degrees, dorsiflex the ankle, and provide a little bit of tension to the back of the calf. And everything seemed normal there. Next, we're going to do is check for any thrombus or any occlusion of the arteries. So I'm elevating her legs. I'm going to have her flutter her feet for 60 seconds. So go ahead and flutter your feet for me. Good. After the 60 seconds is done, I'm going to indicate or have her stand up, and I'm going to be noticing for the blood flow returning back to her feet. In the feet, you should come back in about 10 seconds. In the ankle, 15 seconds is what is typically seen. Then after this, we're going to assess for like varicose veins. If a patient has varicose veins, if the valves in the veins aren't working correctly, we're going to be able to assess for that. Okay, I'm going to have you stand up. Blood flow has already returned to the feet. And ankles has returned as well. You can stay standing. So what I want you to do, we have a bone in our pubis. It's called our pubis bone. So it's like, I would just say, below our belly button, around this area, there is a bone. Can you palpate that for me and feel that? If there's like a hard bony prominence in that like pubic area. So if I'm invading or getting too close to something you're uncomfortable, can you just please let me know? Right there, okay? So can you put your hand right there? Thank you. So I'm going to go 4 centimeters inferior and 4 centimeters medial to get to the femoral saphenous vein, or the great saphenous vein. Then from there, I'm going to, good. I'm going to have you hold the gown for me, please. Thank you. And I'm just going to go 4 centimeters down here. And all I'm going to do with my top hand that's closest, that's more proximal to the center of the body, I'm just going to tap here, and I should feel no vibration in my lower hand, which I don't. That would indicate the valves in the vein not working correctly. So I'm going to do the same thing. I'm just going to take a different approach. So I'm going to use my same hands here, feeling for that great saphenous vein, or the femoral saphenous vein, going 4 centimeters below my other hand, and I'm with my top hand that's more proximal, I'm going to tap. That's great saphenous, and again I feel no vibration in my lower hand, which is normal. And that finishes our lower extremity of